ETM Hotel, Rennie Sean. Welcome and peace. My name is Sean. I'd like to thank everybody for tuning in to Science with Sean. Please like the show, share the show, tell a friend. We in the building. Um, we want to actually get into what I was supposed to get into yesterday. So I'm just going to dedicate a little bit of time actually getting that going. I'm not going to waste too much time, but I'm going to get into it. Appreciate everybody who tuned in yesterday when we dealt with the whole teachings of the Congo, the Igbo, the Yoruba. Who else did we? Togo, um, even the Egyptians. Um, we can go even other places, but I don't I don't want to get into any of that today. Um, People can't seem to fathom the teachings that are 800, 900, 1,000, 2,000, 3,000 years old, and try to bring them and infuse them into something. Never mind. Never mind. In the words of Uncle Kick, I see you. Don't make me go and clip yesterday's video and then turn around and clip today's video and then set that ass on fire. Because when I asked you about was the earth a boiling fire or whatever, you act like you didn't want to answer that. You avoided answering that. I said, was the earth not hot before it cooled? You didn't want to answer that. And then you just said on that show, yeah, we all know it was hot lava and all of this and that, but I didn't want to get into all of that. Why you didn't want to get into all of that, Why you didn't want to get into all of that? See, you don't want to give people credit where credit is due in their teachings. They didn't claim to be scientific. They were actually teaching these things to explain their natural world, which you totally agreed with when we were offline and we were shutting your ass down. So quit going over there trying to hit the live button to try to get some fans to actually agree with you on something that you was incorrect on. And your cronies, they knew you was wrong on it. They knew you was wrong on it. How you gonna tell them that their teachings was just wrong, yo? How much of their information was wrong and how much of their information is right? Why we not talking about that? We don't expect these people who don't have the technology that we have, who didn't have the technology that we have today 1,000 years ago, 2,000 years ago, 4,000 years ago, to answer all these particular questions that are still not answered, but are being brought into the equation or into the discussion today. That's cherry picking, buddy. And that's pseudo. We're being real pseudo. But how y'all doing today? Bear with me, man. I'm a little crippled. My hand hurt today. I'm trying to pull my book up. So for those of you who have what SARS-CoV-2 taught me, I'm gonna get into that and some more information. But before I actually get into that, right? I need y'all to like the show, share the show. We need some people in the building. Okay, now I got what I need on my book. I didn't want to pull my book up. What's good, everybody? What the need, what the business is. All right, so let's go into let's get to it, man. I know some people don't want to actually have this conversation. It might be, they might be better entertained over there with people who don't know how to read or comprehend what's being said, and then materialize their own perspectives or interject or project on some people who wasn't projecting on themselves. All right, so This was published in the AMA um, on the 22nd, and there was 14 terms that every patient should know about the COVID-19 pandemic. The senior news writer Sarah Berg, she did a really good job in this article, and um, it comes down to, let me make this bigger. And it comes down to some of these key terms and understanding what they actually mean for people to comprehend what the science is saying. A lot of times when people are having conversations about the pandemic and what's going on in the world and how things are transpiring, most people are lost, right? All they care about is if they're going to get sick or not. So we're going to get into some of this now. Peep Game, she says accurate information is key to understanding how to prevent the spread of COVID-19. Anybody in the chat disagree with that first sentence? Accurate information is key to understanding how to prevent the spread of COVID-19. If you agree with that, drop a 1 in the chat. If you disagree with that, drop a 2. Accurate information is key to understanding how to prevent the spread of COVID-19. But what can be difficult is increasing number of complicated terminologies and what seems like an upheaval in our language with new or unfamiliar words that have developed over the course of the pandemic. So let's get into it. Making matters worse, these basic concepts have been muddied by misinformation. I'm going to say that one more time. So it says, making matters worse, some of these basic concepts have been muddied by misinformation. From asymptomatic to breakthrough infections and booster doses, there are some terms physicians can help their patients grasp to improve their understanding of COVID-19. The AMA recognizes the critical importance of scientific integrity. Y'all remember that book I keep showing y'all about scientific integrity? What Unc and what's his name, Cedric don't have? They don't have any integrity, so they want to go and interject certain things. So the AMA recognizes the critical importance of scientific integrity, transparency, and public trust as we fight to contain the global spread of COVID-19 and plan the authorization, distribution, of administration of COVID-19 vaccines. You need to stay up to date with the AMA on COVID-19 vaccine development. So here's a brief glossary that's going to help people, guide physicians through their different terms to help educate people. Now, I find that this is very important, and this is going to be the bridge, right? Right. Okay. So my book is supposed to introduce people to certain things to help them be able to understand what's actually taking place in the middle of a pandemic, right? It's a tool, a useful tool. Okay. It wasn't written, be written, and all this other stuff. It was written to be used as a tool to help everybody that's in this chat, people that'll come in this chat later, and people whose lives are on the line, specifically our brothers and sisters, because we struggle with this the most. So the first thing we're going to go over is, what does asymptomatic mean? When a person has no symptoms of a disease, but can still transmit the virus that causes the disease to others, this means they are asymptomatic. In terms of COVID-19, this means a person does not have a fever, dry cough, sore throat, shortness of breath, body aches, or other common symptoms. When a person has COVID-19 but is asymptomatic, they pose a risk for spreading COVID-19. That is why it is important to get tested, isolate if result is positive, and get medical care. I'm going to run that back for you again. Asymptomatic means a person has no symptoms of disease, but still can transmit the virus. That's a short term. All right. Asymptomatic just simply means someone who tested positive for COVID-19, but has no symptoms of disease, but still can transmit the virus to other people. They don't wear masks. They walk around like they just didn't catch COVID. They cough in the air, they touch certain things, they do all of that. These people are around us on a day-to-day basis. You would never know that they had COVID. Another thing that people like to argue about is booster dose, not understanding what's actually going on. However, we need to know a little bit more. So, what can we learn about booster dose? A COVID-19 booster is a dose of vaccine administered when the initial sufficient immune response to a primary vaccine series is likely to have waned over time. See this word right here, right? This word is significant in understanding. This word right here. This word basically is saying that, hey, booster dose, why they recommend booster doses because your initial vaccine um, doesn't has an initial sufficient immune response to a primary vaccine series. So a booster's job is to go in there and to raise your antibody level back up. Now, they do not have a vaccine schedule for COVID-19 vaccines. So that is what it is when it actually comes to that. We just want to keep it short and sweet. Booster dose is a simple thing. It is a vaccine administered when the initial sufficient immune response to a primary vaccine series has lost its protection over time. The loss of protection over time. Now, there's also something called an additional primary dose. The administration of an additional vaccine dose, which is considered part of the primary series, occurs when the initial immune response following a primary vaccine series is likely to be insufficient. This may be needed for people who are moderately to severely immunocompromised, right? An additional primary dose is always subjected on the immunocompromised because they struggle to gain protection. I guess I gotta argue with the pseudo killers to get everybody in the building, huh? All right, our next one is breakthrough infections, and this is where we're going to stop for now. Some people who are fully vaccinated may develop COVID-19, which is expected. This is a breakthrough infection, which is defined as detection of SARS-CoV-2 RNA or antigen in respiratory specimen collected from a person 14 days after receipt of all recommended doses on one of three vaccine authorized or approved in the US. This is where the water gets muddy. People are under the interpretation or people are under the understanding that vaccines are supposed to protect against infection and breakthrough infections are not supposed to occur because vaccines have worked so well initially for other diseases. I mean, for other against other viruses and the diseases that follow those viruses, that this is supposed to do the same thing. No vaccine is 100% infectious at preventing infection. That's not even the goal. The goal of these vaccines need to be clear cut. And we need to understand what the goal of the vaccines were. The goal of the vaccines were to prevent the spread of infectious disease, hospitalizations, and death. Those three things. If the vaccines protected against infection, that was a plus. Right now, we are given an additional booster shot or booster dose because of new variants either evading vaccine protection or have become more um, elusive or evasive from that protection. So now we're trying to get some protection against these different variants that that may have the possibility to evade or escape your vaccine immunity. Okay, like I said, bear with me because my hand hurt real bad. All right. If you got my book, in the back of the book, it has bonus material, understanding breakthrough infections and vaccine effectiveness. This was an important chapter because it gave me an opportunity to set a foundation in case in further research I could advance this information into a fully loaded chapter or potentially a small book, which may come out of that and educate people a little bit more. However, the term breakthrough infection is wrong. Most human vaccines do not prevent infection. They prevent disease, which is what COVID-19 vaccines were tested for. It doesn't matter if infections occur. What matters is moderate to serious disease. That's what matters. I'm going to say that again for people who seem to have an issue or a problem with this thing. The term breakthrough infection is wrong. Most human vaccines do not prevent infection. They prevent disease, which is what COVID-19 vaccines were tested for. It doesn't matter if infections occur. What matters is moderate to serious disease. As breakthrough infections emerge across the country, anti vaxxers made it a priority to focus on vaccines not being effective at preventing infection, as if viruses somehow dissipate. In the middle of a pandemic, vaccine hesitancy in the public has been on the rise, and most of it stems from a lack of vaccine understanding. Regardless of how much effort scientists, doctors, and nurses have utilized to properly educate the public, misinformation seems to spread a lot faster than the truth. My goal is to elaborate on what Vincent Racaniello stated, but also make sure that we have at least the basic understanding of what vaccines are, if they are failing, and if vaccinated people are transmitting the virus. Let me stop right there. So, in the introduction of this bonus chapter, I laid out the foundation clearly. Using the word breakthrough is wrong, right? And then I said, and then it goes on to quote Vincent by saying, human vaccines do not prevent infection, they prevent disease. That's what the vaccines were tested to do. So let's go through and let's look at Cleveland Health Clinic. And let's see what the infectious disease panelists say about this. What to know about breakthrough to COVID-19 cases, plus the role of Delta Omicron play. As you can see, this was published on the 22nd. So this brings up, more information, which is fitting, especially if I wanted to expand my bonus chapter. So breakthrough cases of COVID-19 seem to be more prevalent than ever. But just how common and how dangerous are breakthrough cases? And can they be prevented? So to get the facts about COVID breakthrough cases, we talked to infectious disease expert Stephen Gordon, MD. He explains what they are, why they happen, and whether vaccines are still effective. Spoiler, they really, really are. We know that. So, what is a breakthrough COVID-19 case? According to the CDC, a breakthrough case is when a person tests positive for COVID at least 2 weeks after becoming fully vaccinated, which includes receiving a booster or a third dose if eligible. Breakthrough cases are, as the CDC notes, to be expected. While the COVID-19 vaccines are highly effective at delivering immunity, no vaccine is 100% effective. But another goal of the vaccine is preventing serious illness. And in that regard, COVID-19 vaccines are successful. Throughout this pandemic, we've talked about flattening the curve, Dr. Gordon says. And the vaccine has effectively done that. These spikes in severe cases of COVID 19 are primarily among the unvaccinated, not among people who are fully vaccinated. I'm going to say that one more time. These spikes in severe cases of COVID 19 are primarily among unvaccinated and not among people who are fully vaccinated. So, what are the symptoms of breakthrough cases? The symptoms of a breakthrough case are the same as with typical COVID-19 cases, but people who are fully vaccinated, boosted with cases of COVID-19 are less likely to develop serious illness than those who are unvaccinated. Many breakthrough cases are either asymptomatic or have symptoms that are far less severe than cases in unvaccinated patients. The vaccine and boosters are absolutely key here. So let's talk about that, because when we looked at the terminology, right? When we looked at the terminology of what asymptomatic means, it means someone who can spread the disease but doesn't have any symptoms. But fully vaccinated people clear the virus. So the viral shedding process, or the period of infectivity, is a lot less than those that are unvaccinated, whether they've been infected before or not. If they've been infected before and then reinfected, their viral shedding process is still the same. This is the problem with people understanding exactly what's going on. And that good guy, feel free to come on, man, when I get done with my spiel, bro. I would love to hear what you're saying is bullshit. All right. Now, how common are breakthrough cases? The CDC is collecting data on vaccine breakthrough infections. But because many breakthrough cases are asymptomatic or mild and aren't reported by people, the total number of reported breakthrough cases likely represent an undercount. This is true, similar to that of the deaths, because people like that good guy, he could have caught COVID, right? Now, he don't know if he got COVID because he don't want to go get tested. But what he'll do is he'll get up and continue his day-to-day life, infecting other people and not knowing that he is carrying around a pathogen because he's not expressing any type of symptoms. He's asymptomatic. He don't have any symptoms. He don't have any symptoms from the disease. He just don't. But he's still a carrier of the virus. So now he's affected other people, and now he says that everything is BS. That's that guy. So the CDC is, however, keeping track of one important metric regarding breakthrough cases, because we can't get people like the good guy to go get tested. This virus continues to circulate in the population, in the communities, and then new variants continue to emerge. Hence Omicron. But that's another argument, because a lot of science tends to leave that to the immunocompromised, especially those with HIV, where the virus can multiply 30 plus times in a human body and then leave out differently than it came in. But it says the CDC, which has created a database to track these cases, reports that a person who is unvaccinated is 10 times more likely to test positive for COVID-19 and 20 times more likely to die of COVID-19 than people who are vaccinated. I'm going to run it back. Based on the data, unvaccinated people are 10 times more likely to test positive than those who are vaccinated, and 20 times more likely to die. So I want to put this in perspective for a lot of people. There's about 100 million people who are not fully vaccinated, right? 100 million people that are not fully vaccinated. Out of that 100 million people, they are 10 times more likely to test positive and 20 times more likely to die. Not everybody, but that is the data, right? Okay. In short, people who are fully vaccinated and boosted can experience breakthrough cases and exhibit symptoms of illness, but the chances of contracting a serious illness remains far lower compared to people who are unvaccinated. So this goes back to the point of, what is the job of the vaccine? Do we know what the job of the vaccine is, or we're just going to say, Sean, that's BS? If you don't know what the job of the vaccine is, you can't say, Sean, that's BS. What you can say is, Sean, I have some questions and some concerns. Can we discuss them? And then we can get to it. Because if you just talking and you ain't got no source, it's going to be pretty hard for you to get to your point. So why are breakthrough cases happening? We know this. No vaccine is 100% effective. So breakthrough cases were always expected. Breakthrough cases can come from all COVID-19 variants, but right now, most seem to be from the Delta and Omicron variants. See, this is what we know about virology. Virology teaches us that these viruses that we've been vaccinated against, especially in our youth, have not gone away. Polio is still running around. The problem is that so many people vaccinated with polio, we don't see them testing for polio that much. Measles, mumps, rubella is still around. We know that because we've had measles, mumps, rubella outbreak in the United States, in the Bronx, before this whole pandemic kicked off in 2019. And then we had the Samoa case of an outbreak. So we know the viruses haven't went anywhere. Chickenpox is still a reality. All right, I got some information from a school I'm gonna jump over not saying names and who I got it from and saying all of this, but a school in Florida sent some information home that people needed to vaccinate their kids against chickenpox. I'm gonna just say it like that. Chickenpox ain't even been around in so long that people don't even know what chickenpox is, but it's still around. Whooping cough is still around. They give the vaccine to kids when they're born, so they don't develop whooping cough. Right? So these viruses don't go anywhere. They continue to infect. The problem is that if they do break through, the human mind, body, and soul, I like to say that, the soul part, but in our reality, if it ain't severe and it's something mild, we link it to that of a common cold. You don't go to your doctor every time that you catch a little common, what you call a common cold. Oh, I feel a little sick. You go get a COVID test and you test negative, but you still feel a little sick. But what if they tested you for all viruses and then they found one that broke through and then it gave you more data? See, it's only prevalent right now because COVID is a hot topic. But what if they had testing for every virus at these vaccine sites? Then we could indicate breakthrough. Oh man, you got a measles breakthrough, but you ain't experiencing no severe disease. Your symptoms have been reduced. Whooping cough. Oh, your symptoms have been reduced. Oh, something else. Your symptoms have been reduced. Like you would know more. So then this would help you understand how vaccines work. It's about vaccine science and technology at this point. All right. So anyway, the Delta variant is more transmissible than previous variants of COVID-19 virus, and Omicron variant seems to be too. At this point, though, cases from these two variants haven't proved to cause more serious illness than other variants. Still, the data showing that people who are fully vaccinated are less likely to become seriously ill demonstrates that the vaccine is indeed doing a good job. Right now, the definition of fully vaccinated includes getting your third dose or booster, which is the absolute best protection against breakthrough cases from variants of concern. So Omicron, first reaching the U.S. in December 2021, has since spread quickly. CDC says it believes anyone with Omicron infection can spread the virus to others, even if they're vaccinated or asymptomatic. Research is still ongoing with that. The Delta variant was reported in July of this year, accounted for over 83% of the U.S. cases, was more transmissible than previous variants. The Delta variant is at least two times or twice as contagious as the previous variants. So what to do if you get a breakthrough? If you or someone in your home gets sick with a breakthrough COVID case, the best course of action is to isolate. They're going to continue to tell you that. This is especially true if anyone in your home is unvaccinated. But here's the thing. The CDC says that patients with self-isolated are okay to end the isolation after 10 days after the onset of symptoms. If you have a fever 24 hours after it breaks, the good news, Gordon says, is that breakthrough cases for vaccinated individuals are rarely serious and usually relatively mild, underscoring why it is so essential that every eligible person get vaccinated. I'm going to stop right there because I want to stay on breakthrough and I don't want to get into the other path because I want to come back to my book. All right, so we're dealing with two featured experts here, Dr. Kellen and Dr. Maragakis. All right, and they're talking about breakthrough infections, corona virus after vaccination. Now, they define it here. A breakthrough infection is an infection with the virus, bacterium, or other germ after you have been vaccinated. This is an expected occurrence for a small percentage of those receiving any vaccine. Since no vaccine for any disease is 100% effective in preventing infection in every person who receives it, Breakthrough coronavirus infections happen when someone who has been fully vaccinated for COVID-19 becomes infected with SARS-CoV-2 coronavirus. All right. Now, McCarkis and Killen basically go into their build. Now, can you get COVID-19 after being vaccinated? Yes. Breakthrough cases for COVID-19 cases in people who are fully vaccinated, and they seem to have more frequently now than the Delta variant is circulating widely, and immunity may be waning among those who got the vaccine many months ago. All three available coronavirus vaccines are very good at protecting you against severe forms of COVID 19, but they are not 100% effective in preventing infection. Breakthrough COVID can be caused by the Delta variant, which is more contagious than some other coronaviruses. This is the issue that we have with people. People are under the assumption that the vaccine, oh, well, people who still get vaccinated still catch COVID. Breakthrough cases happen, yes, but not for everyone. So how common are breakthrough cases? I seen the science yesterday. It was like 1 in 5,000 may experience a breakthrough infection. And then, of course, this study in Washington states that they gathered over 4 million fully vaccinated people. The data showed a rate about 1 in 5,000 experience a breakthrough infection between January and August. More recently, some populations have shown breakthrough rates of approximately 1 in 100 fully vaccinated people. Omicron's ability to mutate and evade vaccine protection. Is coronavirus after vaccination dangerous? Breakthrough coronavirus infections can cause mild or moderate illness, but the chances of serious COVID are very low, especially for people who are not living with chronic health conditions. The COVID-19 vaccines are very effective in keeping you from having to go to the hospital, being put on a ventilator, or dying. I'm going to stop right there. I want y'all to think about this. Is the coronavirus after vaccination dangerous? The vaccine's job is to prevent the spread of severe disease, hospitalizations, and death, and they do a good job at that. So Chavis is not in the building, but he may be in the building. His grandmother has a breakthrough infection, but she ain't having serious disease. And she is happy about that because she knows that she could be hospitalized. And she was nervous about it. But the vaccine protected her enough to afforded her that much protection that she has little to no symptoms. And, she feel very good about that. That's what the vaccines are supposed to do. All vaccines, they ain't gonna stop everything. A virus's job is to evade your let me do this one time, man. A virus's job is to survive just like you want to survive. Viruses are not living, nor are they like, you know, dead or whatever, right? Viruses infect people. They look for ways to infect people. Okay. I want to go to my virus chapter, but I don't want to get into that because I'm going to save that for a lecture. However, the virus job is to infect your cells. If you're vaccinated and the virus doesn't evade that protection, it continues to search out a cell to infect. Now, this is what people don't know about their bodies. And I want to see if y'all know how many how many cells are in the human body. I know there's a delay, but how many cells are in the human body? How many cells exist? And then how many pathways can a virus infect you? I want to know who know. I don't care if you Google it, if you know off the top of your mind or anything like that. How many cells are in the human body? Come on, people. Thumb up the show. If you don't know, I'll just go ahead and say this, that's like 38, well, not really 38, but I'm just rounding. So let's say that 37, I think it's what, 37 trillion cells in the human body. If you go look up if you're familiar with human biology, I think it's 37 trillion cells in the human body. There you go, double R. 37 trillion cells. A virus is very invisible. You can't see it unless you got a microscope or electron microscope. And the viruses is constantly attacking you. It is looking for a way to enter the cell. Specifically, SARS-CoV-2's fatty spike protein is trying to latch on every single cell in your body, or at least one cell in your body, and make duplications of that cell and then affect the other cells in your body. And that's how the spread of infectious disease occurs. And this is where the vaccine steps in, because the vaccine has trained your immune system to recognize the foreign pathogen, blocking them from infecting those 37.2 trillion cells. However, there might be one that evaded the virus, got through to it, broke through, and infected that particular cell. And then what happened next was you went and got tested, you tested positive, but the viral load was low because your vaccine was working, and therefore you didn't succumb to severe disease. Thank you, double R. 135 metabolic pathways for a virus to enter your body, and 37.2 trillion cells to affect. This virus is trying to, quote unquote, survive. It's not just one virus floating around and just touching bodies and, replicating and duplicating itself in your cells, and then and then going somewhere else and being transmitted, so everybody's just accidentally touching it. The virus is airborne. It could be on certain material, or things that you may have touched. Somebody might have sneezed, coughed, been arguing with somebody and spitting, and they've been infected, and boom, it's in the atmosphere. It's in the atmosphere for a long period of time. And the only time a virus is at its weakest point is if someone who is infected was isolated in an area for a certain amount of time. Then the virus has no place or no person to infect, and then it goes away on its own. It has no survivability because it can't infect someone else. It needs to continue to affect. So these whole 20, what is it, 29? How many people in America? 27 or 29 million COVID-19 cases. Somebody can correct me if I'm wrong. I don't mind. I ain't thinking of it like that. But what I'm trying to get you to say is that people are being infected. The vaccinated people are just afforded more protection. So there's more good that outweighs the bad. There's just more, there's a level of protection that natural infection can't gain. This is why breakthrough infections occur in some instances, but reinfections occur at a higher rate. So, what are the symptoms of COVID after vaccination? The symptoms of breakthrough COVID-19 are similar to COVID-19 symptoms. We just read that in another one. If you're fully vaccinated and develop a fever, feel ill, or experience any symptoms that is not typical for you, getting a COVID test may be a good idea. The problem is that we really need a push for more testing, because that good guy, if you're still here, I don't know if you've ever taken a COVID test, but if you have, how many have you taken, if you don't mind? How many people in the chat actually have taken a COVID test? Look, I can tell you right now, my son Elijah has had two. I think Caleb has had 2. And then I think my oldest son, Pimpin, I think may have had 1 or 2. And I know their mama done had 2, or 1 for sure. Or I think she had 2. I think she fully vaccinated, but I think she still went and got tested because she got Elijah tested and Caleb tested, so she got tested. Let me get this bot up out of here. So, who is more at risk for breakthrough COVID? Although a fully vaccinated person can experience a breakthrough infection, people with weakened immune systems caused by certain medical conditions or treatments, including organ transplant, HIV, and some cancers, and chemotherapy, are more likely to have breakthrough infections. So, when we had our brother William on a panel the other day, he survived cancer, right? Pancreatic cancer, I think, is what he did. He would be susceptible for reinfection. He would be susceptible of infection, and he can get ran through. But he on Facebook crying, but bro, it's a serious thing. So all right, let me go back to my book. All right, so what are vaccines? Vaccines are products that protect people against many diseases that can be very dangerous and even deadly. Different from most medicines that treat or cure disease, vaccines prevent you from getting sick with disease in the first place. To add, no vaccine is 100% effective at preventing disease. And we know this to be certain because of our history of immunization in the New World. The initial vaccine efficacy prior to mRNA vaccine data required by the FDA was set at 50% to 60%. Scientists urge the FDA that efficacy rates should be just a tad bit higher, somewhere around 70 to 75. Flu vaccine efficacies around the initial rate of mRNA vaccines were required, but as of the year progressed and data became available, both Pfizer and Moderna vaccines were 94 and 95% effective. We had a flu vaccine not even a few years ago that was 32% effective at preventing disease, and it was being administered. Now, what is efficacy? Efficacy is determined by how well a vaccine prevents the spread of disease. This is important to know because without this data, most vaccines will not be approved. But how it is measured requires proper understanding, and according to WHO, a vaccine's efficacy is measured in a controlled clinical trial and is based on how many people who got vaccinated developed the outcome of interest, usually disease, compared with how many people who got the placebo, dummy vaccine, developed the same outcome. This is my book. I'm not going to too much get into the rest of that. What made you retract your comment, bro? But if you got the book, there's a hell of an argument that goes through. So, what is the deal with breakthrough infections? I'll tell you, it is completely blown out of proportion. According to the American Medical Association, which we just read, nevertheless, the fact remains that getting vaccinated is effective in preventing people from getting severely ill or dying from disease. Even as new COVID-19 variants appear, vaccines continue to hold their ground. But since no vaccine is perfect, it is expected that we will see some COVID-19 breakthrough infections. More than 161 million people in the US have been fully vaccinated against COVID-19, according to the CDC. Now, meanwhile, the CDC reports that there have been more than 10,000 COVID-19 breakthrough cases. This was before Omicron. This was in the heart of Delta. However, while the CDC initially tracked all breakthrough COVID-19 infections as of May 1st, the agency shifted to only tracking those linked to hospitalizations and death. Because initially, when they were tracking these things, it wasn't a lot of it. So now they needed to know who had a breakthrough infection, who was going to the hospital because of a breakthrough infection, and who was dying from a breakthrough infection. We needed that data. I ain't gonna give y'all the whole chapter, like I said, because it's in my book. If you got my book, you got a nice piece of work. Now, I'll tell you when you bring up the chat. Before I even bring you up, I asked you a question. You can't answer the question. We ain't even off to a good start. I just asked you how many times you had a COVID test. Well, I need you to come on the panel to tell me that for. You're off to the wrong start already. All the way off. So give me 1 second. I want to bring something up real quick. And then I'm gonna bring this brother on if I feel like it to get his spiel. Because I don't know what he says is BS. So that good guy, okay, cool for you. All right, so the good guy, I need you to understand what this conversation is about. This is about breakthrough infections and so on and so forth. But I really need to know what was said on this show that was BS. Caleb Loud. Hold on 1 second. Thank you for finally answering that. All right, let me get this pulled up, and then we're gonna get into it, and then we're gonna let this thing ride out. So give me a second. I want to go back to a show that was done with Paul Offit on there, and just want to play a little bit of this, and then I'm gonna bring the brother on, and we're gonna get to it. We're gonna have that conversation. I hope you got some sources.
I get the same horrible gut level feeling.
Yeah. So basically, go ahead, Graham.
So I feel like a lot of the things we've been mentioning, including sort of Dixon's comments, are still getting at this individual versus population issue. And I think that what we've said about boosters in particular is kind of, it doesn't make sense for them to be mandated for the entire population. But I guess, what are your thoughts about boosters and individuals? Is there a downside to getting a booster for an individual? Or should individuals be getting boosters, or is there a reason to not get that booster? Because you've also said there's no reason to not get a vaccine.
So here's I think that if you're over 65 years of age, I think it's reasonable to get a third dose of mRNA-containing vaccine. The J&J vaccine was always a 2-dose vaccine. I think you should get a second dose of J&J vaccine. I think if you're over 50 and you have a high-risk medical condition, I think, especially obesity, I mean, that seems to be the single most important factor associated with that it's reasonable to get a third dose. What worried me and what worried my fellow voters on the FDA's Vaccine Advisory Committee was the young, healthy person. So now when you're talking about a 16 or 17-year-old, where you know that at least the Israeli data and the U.S. data for myocarditis, for U.S. it was about 1 in 5,000. For Israel, it's about 1 in 7,500. That's not trivial. I mean, and I'm sure that over time, although it appears to be a short-lived, self-resolving, transient phenomenon, there will be a spectrum of illness associated with this, and so there has to be a compelling reason to do it. And if the compelling reason, which is right now, to make sure that you don't have a mild infection or a low moderate infection for a certain period of time, that's just not a great reason, and to me. And so I guess that's where I have, and then to sort of mandate it, for a young person, say, to walk into the New York Philharmonic. And somebody told me that they're now sort of making that a 3-dose thing. But
do you think that a third dose will come up for kids?
Well, now for that sort of 6 months to 5, the less than 5-year-old, they're not doing the 3-dose series, but that's more the primary series because the 2 doses didn't work.
Right. But in the, say, 5 to 11s.
I don't know. I hope not. I mean, I'm willing to be open-minded to the fact that protection against severe illness doesn't hold up with Omicron, but I really want the CDC to show that. They should show that, because I wonder whether I just hope there's no disincentive to showing that, because they've already made the recommendation. They'd be willing to show data that opposes that recommendation. They should.
Yeah, that's a great point. If it turns out that even people with 2 doses are fully protected against severe disease, then they should say that, right? I mean, as the studies are ongoing, I'm hoping we'll see those data, and so they should be. If they want to maintain their credibility as a public health institution, they should, right?
Yes.
So let's say the timing of the first 2 doses is what interrupted generation of memory. So the 3rd dose fixes that. Why don't we then go to a dose and then 6 months later a 2nd dose? Couldn't we? Do we have to do a trial for that?
I think it's a great point. I mean, I think at least from the data that I've seen you guys present and read, also, there does seem to be that interval, that longer interval, does seem to provide, a higher titers of neutralizing antibodies, arguably broader neutralizing antibodies, and I'm sure that's a value. So, sure, I think that when this all first launched, you just wanted to get as good of immunity as quickly as you could. Now there's a little more time. The only thing that I would argue is that if you get just 1 dose and you're waiting now 6 months,
sure.
What's going to be the protection during that 6 months?
Sure.
Exactly.
No, that's a perfectly good point, that your risk is there between those doses. Yeah, it's a balance. I totally agree. And it may argue for 2 closely spaced doses, which we know are good, and then a 3rd later on. But I'd love to see the data. So, and I mean, in particular, kids who are just getting vaccinated, it seems a shame to give them 3-4 weeks spaced and then another one, whereas they could get it all at once. But I suppose we don't have the data. Yeah.
No.
It's
it does raise another point about another disease, of course, and that's flu. We sort of skipped a season for flu because everybody stayed indoors during the 2020 event, but no one's doing that anymore. So there must be more flu coming up as we speak. There doesn't seem to be a reaction against the flu vaccine like there is against this one. Any thoughts about that?
Well, you're certainly right. I mean, the most common reason now for children to come into our hospital is influenza. Second is respiratory virus. Third is human metapneumovirus. COVID is actually 4th among the respiratory viruses. So yeah.
Interesting.
What was it?
My bad.
Interesting. Last year, typically 75 to 150 children will die every year from flu. Last year was one child.
Wow.
I mean, on the FDA Vaccine Advisory Committee, you have to pick flu strains every year, and you pick based on what's circulating from the previous interval before the effect. There really wasn't much. Virus. Third is human metapneumovirus. COVID is actually 4th among the respiratory viruses. So yeah.
Interesting.
What was interesting, last year, typically 75 to 150 children will die every year from flu. Last year,
75 to 150 children will die from the flu, has died from the flu. This is every year, but only 1 child died of the flu last year. Why is that? Because people were wearing masks, people were social distancing. The virus couldn't find a viable host. The virus couldn't do what it normally would do that season or last year. People were locked indoors. There was places not open, so viruses couldn't be transmitted. This is why this is evidence of this is a public health issue. This is evidence for that. Last year, we slowed the flu virus down by staying indoors and businesses being shut down. So I wanted to kind of touch on that a little bit too, because those are measurements for solutions for dealing with golly, my hand messing this all up. Dealing with viruses. All right, so let's transition to the back end. What up, Keenan? I thought you was over there with the pseudo killers, getting pseudo-razed. But that good guy, there's the link. You're more than welcome to hit the link, and you can come on and we can build. But first thing first, though, bro, I want to get into what is the first thing that you said that was bullshit. I want to know what is bullshit. And then we'll move on to you having to take 2 COVID tests and all the other stuff that you want to explain. So while he's While we're waiting on him to join. Oh man. Time to pay some bills, y'all. Yeah, let me knock that on out. But I'm waiting on him to join. And peace to everybody, man, that has been coming in and out. We got the good guy live in effect with us on the Mossy Warrior Clan YouTube channel. This is Science with Sean, episode 2 million. Hold up. All right, there you go. My bad, man. I was pressing this button. I probably was pressing too many times. But first, man, I'd like to welcome you to the show. Appreciate you for hopping on. How you doing?
How you doing, bro? Peace, peace.
I'm doing good. Now, can you explain to everybody who you are, the good guy?
I'm just a regular black man. Just trying to have this conversation with you about this virus. That's it.
No, not that you're a regular
Oh,
black
hi.
man.
So my thing was I've been around a lot of people who had it. So I never got the shot. I never got the virus itself. So I've been around people at work. I've been around people in my household and my mother, my children's household. So I say about a good 20 people I've been around. Like I said, I had two tests. Matter of fact, I had 3 tests to be exact. I forgot one. So every time I got tested, I came up negative for the virus. So that's why I say like the breakthrough thing. You said something about in the beginning. You said something about most of the breakthroughs was caused by people who was non-vaccinated, and
No.
unless I heard it wrong.
Yeah. So breakthrough infections. No. When you hear the word breakthrough, which is the wrong word to use, but when you hear the word breakthrough, these are people who have been fully vaccinated. The way breakthrough is defined is people who have been fully vaccinated. Okay, and they have encountered a breakthrough infection. Never said that unvaccinated people were causing. I think what you may have heard. What I did say, and you may agree, you may not agree with it. What I did say is that, and I think this is what you may be alluding to. Okay, and this might help with the correction that these variants, right? These variants are occurring because of unvaccinated people and immunocompromised people.
All right, so I will have to put myself in that equation because I'm not vaccinated, and I was being around people who were vaccinated. So he's trying to say, well, is the data saying that these unvaccinated people are asymptomatic and they're spreading this virus? Is that the consensus, or is that what they say?
Well, first, the good guy, you would have to be infected, right? You would have to be infected first for you to be an issue going around the people that you go around. What the science says is that asymptomatic carriers of the virus are susceptible of spreading the virus. Asymptomatic people are people who who show no symptoms, of the disease, no symptoms of the disease, but yet they can spread the virus. So you would have to actually be infected, and when you're infected, you become transmissible at that point. Now, here is the data. Depending on the period of infectivity, if you go around vaccinated people, it is not likely that you would pass on the virus to someone that is vaccinated. It is more common that someone unvaccinated, that if you went around someone that is unvaccinated, that you would actually do that. However, in this instance of the conversation, breakthrough infections, right? If you were you were infected, you went around a household of people that was vaccinated, the virus, and this is science, the virus actually has nowhere to actually attack because the people you're around is vaccinated. You
All
see what
right. My bad. My bad. Go ahead.
No. I was just trying to say it. So you see what I'm saying? So for instance, let's say you were infected with Omicron, right? And you were asymptomatic, meaning you showed no disease, no signs of symptoms, and you went around vaccinated people, and you were shedding the virus, right? You were at your most contagious state, and you coughing, you might have some bad cough, whatever, and someone in the household, right, ended up being infected, go get tested, and they test positive. Oh, he dropped out. Hold on, we'll see if we can get him back. But I'll finish my analogy for everyone listening in the audience. So he was infected with Omicron. This is the example. He was infected with Omicron, right? He goes around people that are all vaccinated. The virus he's at his most contagious point in that household within the first 48 hours or so of his contagion. And that virus was able to infect someone else in the home, but not everybody, but someone else in the home. That would be the case of a breakthrough infection, meaning that they already had protection. He encountered the virus. The virus was in the home. He was contagious, but he didn't show any type of diseases or symptoms of disease, so he was asymptomatic. But they ended up getting infected. They went to get tested, and they tested positive. Right? That would just mean that it evaded the vaccine protection. That's what basically breakthroughs, or what they're calling breakthroughs, are. I hope you kind of heard me on that.
My bad. I made a mistake and kicked myself out. But
Yeah.
I understand.
Go ahead. You went mute. I mean, your mic is still open. Okay, there you go.
You can hear me?
Yeah, I can hear you now.
So breakthrough is basically layman's is just with somebody who's already vaccinated and they still got COVID. Is that what it is?
Yes. Breakthrough is someone who's been fully vaccinated, right? And they just got infected. They tested positive.
Right.
And and then that's when you see the vaccine do its job. But
Right. They got symptoms and all that.
Not necessarily, because you can have a breakthrough and have very little symptoms.
Okay. So
which would measure the disease at that point.
So that's what I'm saying. Like, I can't say everybody, but I know most of the people who got vaccinated, especially my mother, my children. I know my children had the vaccine, and they I would in that sense they had a breakthrough. They all got vaccinated, and they all had it. Besides my 6-year-old, and that's something else I wanted to talk about because I just don't think that they should do children and all that because they said that they are healthy. Well, not healthy, but most likely not to get it. So and that's
that wouldn't be an accurate assessment because children are very likely to get it. We have millions of children who have caught COVID, and then you have a string of children who've actually died from the spread of the disease, and you also have immunocompromised children who can't get any type of protection.
Right, immunocompromised children, but anybody compromised underlying illnesses should get the vaccine. And I'm not against vaccines. I'm just the route this vaccine took and is something alarming. We had a conversation about this before, but I'm still on the fence of even let my 6-year-old get the vaccine just because of that not that conversation, but just because of the studies and what some doctors are saying.
My son's 9 and he's fully vaccinated.
Yeah, my daughter's 6 and I don't believe she should be vaccinated. But
well, the thing about it is that from 5 to 12 years old, the dosage is less than it is for 13 to and from 12 to 15, and then from 16 to adults, the dosages is different. So there's 3 different dose usages for each level. So it's less of a dosage in that 6-year-old, or in the instance of what my kid and your kid would, qualify for with the approved Pfizer vaccine. They would just only get like a what is it, a 10 UG dosage. The normal UG dosage, or the measurement of dosage, would be 30. So it's a less dosage, and they actually get it. And you said it's your daughter, right?
Yes.
Okay. So here's another thing. I don't know if you noticed or not. Well, no. Let you go ahead, bro. You go ahead.
No, I mean, I was not. I wanted to compare this vaccine, but to other vaccines. But so you could
Mhm.
go ahead. I just wanted to.
No. Let's do that. I mean,
Um.
we just having a conversation. So go ahead.
All right. So the next thing. My next point is that comparing this to, like, I would say something that we could relate to, like chickenpox. Even though you
Yeah.
said something. Even though you said something about chickenpox
Hold
to come.
on. Hold on. How old are you first?
I'm 40.
All right. So you know about chickenpox.
That's why I said so we can relate to.
Yeah.
So you and me know that back in our days, when
Facts.
somebody in the family caught chickenpox, they just brung everybody to the house as children. You all gonna catch it.
Yeah, everybody.
So
Well,
with
we
that
didn't have
being,
no chicken, but we didn't do no chickenpox parties though. That's dangerous.
no, I mean, I know my fam. I know my family did it.
Yeah,
So
I know what you're saying though, because they're trying to expose everybody to it, so that later on in life they don't have no issues or anything like that. But nah, we didn't do the chickenpox party.
so isn't that, what is it? Is scabies? No, what is shingles? Isn't
Shingles,
shingles
yeah.
isn't shingles a form of the chickenpox?
Yes. And elderly people get vaccinated for shingles. My
So
grandmother, yeah, I was at my grandmother's this morning, you know what I'm saying? And I was talking to her in the whole 9 yards, and she was talking about the pandemic, and she was like, it ain't time for her to get her booster shot yet, but she want to get it. And she was talking about the last time she was there, she had got the flu vaccine, and she said she had been vaccinated for shingles, and she was telling me what a doctor was saying and stuff like that. So yeah, this shingles is a real deal, bro.
So is it like a variance? Like, I'm asking because I don't know. So is it a variant of chickenpox?
Yeah, you could just say it like that. I mean, for us to keep it as lay as possible, so that we don't confuse it at all, you can say that. You can say it behaves like that. But they say shingles is more painful.
Yeah, that's what I seen on commercials and all that. So the only reason why I said that, because some we relate to, something we could pull from our experience. Because I ain't no doctor,
Mhm.
I ain't like y'all. So what I'm saying is
Nah, I
this.
ain't no doctor either, bro.
but,
I'm a
but
student, man. I'm a student.
but what I'm saying is this: is that we know what a vaccinated a vaccine look like, right? So
Yeah.
we have measles, mumps, smallpox, all this. And but with this, it quote unquote, they not sure it only lasts for 6 months. So what besides this vaccine, what other vaccine only lasts for 6 months?
You got different flu vaccines that have that. Most respiratory vaccines may have a period of expansion. However, I want to be clear on this. They don't know how infectious. This is what we're dealing with. They don't know how infectious the vaccine is for a certain period of time. So when they're talking about something lasting for 6 months, they're talking about your initial protection, right?
Mhm.
They're saying that your initial protection is what's got everybody up in arms. But hold on real quick. So let me I want to make sure that I pick this to you correctly, right?
Now, is
Um
not to cut you off, is that for each dose, or for the fully vaccinated, meaning that double both shots and the booster? Like, it's
Nah,
confusing.
okay, so first, if you know anything about booster shots, right? Booster shots, they don't last long. The booster shots dosage is very small. It's not a large portion of the vaccine. It's not what you actually had the first 2 times you've been administered the vaccine. So they give you just a little sample size to boost your immune response to recognize these pathogens and so on and so forth. So when we're talking about waning protection, right? They're saying that these vaccines, the vaccine protection wanes within a certain period of time, right? From the initial onset. But that doesn't mean your immune system still is not protecting you against certain things. This all has to do with infectivity, a measurement of infectivity. And this is the misconceptions in the community, is that the way that we're looking at the way that we're looking at these things is that we are wanting a vaccine to prevent infection. That's not what these vaccines, none of these vaccines that we have are supposed to do. They are designed to protect against the spread of infectious disease, hospitalizations, and deaths. So when we look at the severeness of the breakthrough, right? This is how you measure it. So someone's vaccinated, for instance, like Anusha, she's in the chat. She just said peace. So let's say she's fully vaccinated, Pfizer vaccine. She encountered a breakthrough infection, right? Now,
Right.
what they're looking at now is how severe is the spread of the disease in her. So let's say she had a breakthrough infection and the severity was high. So they're going to look at from the last time she was administered the vaccine. So let's say she was vaccinated 9 months ago, but she didn't get a booster and the breakthrough occurred and it was severe for her. They're going to investigate that case because they're measuring, well, she was good all the way up until 9 months. But that's also, what that's also telling us is that the vaccine was protecting her against all these different variants for 9 months, right? That's a measurement there. So that's data that we have to know, okay, so we have some vaccine protection that goes out 9 months. Then you might have somebody, and this is just an example. You might have, let's use me for an example. Let's say I was vaccinated in January, hypothetically speaking, right?
Mm-hmm.
We got 6 days to January come around and it'll be a year. And I haven't been infected with anything between that gap. Then they're going to say, well, we have me and 2 million other people who haven't been vaccinated. And this is hypothetical, right? Me and 2 million other people, we haven't had a booster shot. We got vaccinated in January with the initial 2-dose regimen. None of us got infected. And then all of a sudden we get infected in February. There's a measurement there. They're going to look at that. So these people went through a whole year, all these different mutations of the virus. They were out in the public. They were going places. They did their epidemiological work on us and they measured it to find out, okay, so we have a level of people who have some type of protection beyond a year. Here's the thing. We already have that data because we have data for people that when this thing kicked off, when they first started vaccinating people, like not this year, and you know what I'm
2020.
saying? Right. So we have people from March of 2020, the very first onset of people who made it all the way through 2020, going into 2021 and hadn't had a booster shot or anything like that. Not all of the people that were a part of the trial have had booster shots, from my understanding. Some people continue with the level of protection that they got. And then therefore they're like, well, the vaccine protection is lasting quite some time. However, you do have a portion of the community that may be in the elderly and the immunocompromised whose protection may wane, right, over a certain period of time. So we want to boost them to keep their protection levels up, and we can forecast out, because where we're at right now in the pandemic, just being honest, we don't have a vaccine schedule. So this is all predicated on how people are responding to this infection. People want protection against infection. So that's why they're trying to get boosted up, because it reduces the infection part of that.
That's why I don't have a problem with elderly and people who have underlying illnesses getting the vaccine. It comes to when you got healthy teenagers, healthy young children, even healthy adults, and they still getting it. Like me, myself, I've been around plenty of people who have had it, but I have never gotten it, and that's from the beginning of the vaccine. I mean, beginning of the virus. So where I'm at, is in New York. That's where it all started at. So I, from the beginning, I've been around people. I've been in buildings with people who've had it, and I never gotten it. So, but still, in all, it's still a mandate for me to keep my job. I have to get the vaccine. Do you understand? Like the problem, some people like myself who believe in um vaccines, but just not too clear about this one, have a problem with this.
All right, so let's deal with that, right? So they're mandating you to get vaccinated. You have some issues or questions about the vaccine. I um
I mean, my
first,
thing is
go ahead.
my thing is more the sense of if I'm not harming anybody, and therefore I'm not getting affected. Why is it a mandate that I have to get it? If not, I
Well,
lose
there's
my
always
job.
been there's always been mandates. There's always been mandates. Like children can't go to public schools without having a vaccine, having
Yeah,
certain vaccines. So there's mandates, but the way that it's being projected by the media as if it's a real harsh negative is insufficient because we're in the first of all, we're in the middle of a global pandemic, one, and it's a public health crisis. And what's you from New York, right?
yeah,
Okay, so I'm finna. What part of New York you from?
Brooklyn.
Boom, thank you. I knew it. So, for instance, Brooklyn, the Jewish community in Brooklyn in 2019.
All right, the measles guy got you.
Yeah, yeah. So you see what I'm going? So,
But yeah, but they always was like that.
but
Those,
nah, but them you got to think about it, bro. Them Jews wasn't getting vaccinated about nothing around there, bro.
but that's their thing though. So
Yeah, but they mandated that all them people in that Brooklyn community get vaccinated, and you know what they did?
they said, F it. I know.
Nah, they ain't F it. Them jokers was vaccinated.
Oh, but see, that wasn't it after the fact that the story came out that they had what is it? What the measles?
Well, it was measles, mumps, rubella. The thing about it is that it was spreading too fast in that minor community, and you know how they seclude themselves from
Yes,
everybody else.
yes,
So it would be all right. So you're Brooklyn all day through and through. Now I done rolled through Brooklyn. I done been in Brooklyn. I done stayed there. I had an event there. So I know people are on top of each other in Brooklyn.
facts.
If it gets outside that Jewish community, bro, do you know how serious that would affect Brooklyn because it's gonna spread. It's gonna spread
Sean,
from
we had
borough
this
to borough.
conversation before.
Yeah, yeah, yeah.
Right. So we know most people are not homeschooling their children in Brooklyn and New York, period.
Facts.
Everybody, everybody's taking their children to public schools. They take your children to public school. You know you got to give them that blue card, excuse me, that yellow card to show they records of effect
The vaccine
vaccine.
records. Yeah.
Yeah, your records of a vaccination. Vaccinations. You cannot go to school without that. So I'm not saying I don't think it would have hit our community or any other community that bad just because of the way we live our life in New York City. Because we go to public schools, we go to public colleges.
But
So
yeah, but it's not just for instance, and I'm gonna make this make sense. It's not y'all. Think about the visitors. How many people come to New York all the time and bouncing around the boroughs and using the public transportation outlets and things of that nature? It's those people that would encounter it that may not be vaccinated against, and then next thing you know, we have a small what they call it ain't a pandemic, but like a little endemic, right?
mhm,
Of cases in certain part. They don't want measles, mumps, rubella showing up. It's the
no,
same as like polio. Like you don't we do you want to see kids bent over? Like, you know what I'm saying? They only can
yeah,
look down and look up, you know what I'm saying? Like they in
mhm,
a slump position the majority of their lives. Their
right,
spines are all flexed out. Like, yo, that's
no.
it looks painful, but for people with polio, like you know what I'm saying, or a short leg here, or you know what I mean,
Yeah,
come on,
I see people like that. Well, I say one person. I ain't gonna say people, but what I'm saying is
short
like,
arm, like DJ Paul, 666. You know he got he got that little arm, right?
Oh, that's what he got it.
Yeah,
Oh,
bro. Yeah, he got the little arm.
yeah, I know he got the little arm, but I ain't know that's from polio. But
No, those. I don't know if it's from. I'm not going to project that on DJ Paul, but when you
I
look
don't know
at
what it's
polio
from.
victims, when you look at polio victims, and you go back and you look at, you know what I'm saying, some of the cases and how things look, it look like that.
So and another thing, if it's airborne, right now we don't know like the significance of how much of it's airborne, the droplets. They say what
It's hella,
5 minutes.
we're gonna say it's hella airborne, and it stay up there for like hours.
So I don't know if I'm true about what I'm about to say, but isn't that the mean that it's been around? Then most likely, because like I said, I've been tested, but I ain't do the antibody test to see if it been through my system or not, or whatnot. So my question is, isn't it like it been around damn the whole planet? Isn't everybody got some type of infection? Well,
Nah, it's not necessarily that, because there's pockets of this planet where the virus has not even survived in some instances or gotten to. Like, we don't even know the severity in these third world countries. Like, most people are doing a really good job in some instances around the world of shutting off traveling into their countries, like secluding themselves. For instance, Australia.
mhm.
Australia shut down a whole island, or they shut down
Yes, I know.
everything, right?
Mhm.
Over one positive COVID test. One.
Mhm.
Can't nobody come to Australia. Like, one, yo. Think
I
about
understand.
that. Like,
I,
so you got people doing that. But as far as airborne, you're looking at it like, based on studies, they're basically saying if you're in a building, Walmart, you're grocery shopping,
mhm.
and someone is COVID positive, let's just say it like that, right? They're positive for the disease, and they cough. Now, the distance and how long that virus is um, in the air is for hours. So imagine you're on row 9 of the cereal aisle, and that's where the boy coughed at, right there in the cereal aisle. Now it projects out and it's all over there, but it just ain't gonna stay there, because you got other, like what the ventilations, and
Mhm.
ventilation is key and all of that thing, and that
Mhm.
virus is moving around. Man, that thing is attaching, it's trying to attach it and affect this many people.
Yes, it can.
And if you're in a Walmart where there's a bunch of Mexicans that do construction, not to just put it on them, but I'm just saying
Got
hypothetically,
you.
that's hypothetically speaking here, yo.
Right.
Like, them jokers don't be wearing no mask.
No,
That's why I said that. Like, if they do construction, they don't be wearing no mask.
and that's the thing. I do construction, so I know that's why I'm trying to say. Like, I know that it's. I know that a lot of people that around that claim that he had it, but that was my thing. The first reason why I had to get the test is because I was around people who had it. That was twice. That was the two times I had to take the test, because one person I was around lunchtime found out he had it. Boom, I had to take the test, came up negative, and it had happened with somebody else. So once again, a person like me who I ain't gonna say I'm immune to it, but I am gonna say that I haven't gotten it, knock on wood, yet. So why is it it's a must? Like, either that, or I got to be tested for every 2 weeks.
Yeah, so here's the thing with that. Like, what is the benefit? What benefit does it have it for you to even get vaccinated? So here's the benefit, right? To prevent the spread of infectious disease, hospitalizations, and death. That's a benefit. But
Yeah, but
also it helps you protect, it helps you protect your family, your children, and things like that.
mm, I mean, that's my whole thing. I haven't gotten it yet, and eventually, if I leave the country, I'm gonna have to get the vaccine.
Yeah,
But
you
my
can't
thing,
get into Africa. They said no,
I
no, no,
know, and I'm
no.
planning on going next year. But
Yeah,
my
they gonna
thing,
wave their finger at you, bro. Soon you touch down, you better get.
But it'll be what, 2 years since the vaccine been
Yeah,
around.
we need to get it. We need to get in that. But first, what's important is not only does it protect you against the spread of hospitalization, death, and disease, but it also helps you from from a responsible level, right? Because we're in the middle of a public health crisis, it helps you protect the people that you love, but also set an example and a bar and a metric to say that. Now, I said all of that to say there's more benefits than risk. So let's say you said you haven't tested positive for it, but let's say you encounter it and the severity of the disease is high, and then you're hospitalized. Then you're gonna be like, I should have got the vaccine, and then you're on an ECMO machine fight for your life. Like the example and the reasons for getting the vaccine is over 815,000 dead people.
I mean, I can't beat them numbers. I feel you on that. I mean,
But listen though, the numbers are as high as it is, and we have a vaccine that prevents death. That's
sure, it
the
doesn't really prevent death though.
99.98% of the deaths from from this disease are in unvaccinated people.
That's why I say, come on now. Well, I don't know. I got to look
We,
at the
we
numbers, but
yeah,
that
but
just sounds fishy.
we have that data though, bro. That's what I'm
I know.
saying.
I didn't.
We have that data. That's statistics that they're boasting about this. No,
I guess I'm looking at my anecdotal experience, and then look. That's the only thing I could say. That's probably what I'm looking at. Cause
could be true, but what I'm saying is that the scientific community is boasting about the protection against hospitalization and death in these vaccines, bro. They chest this out real bold, like, all right, we know we got something. Like, seriously, they haven't seen a vaccine work this well ever. Ever. It's the first vaccine of its kind, and it's outperforming any other vaccine throughout human history.
that's why I go. I don't know, Sean. That's why I go back to like chicken pox and all that because we see the results from that. I
Kids don't
can't.
even know what chicken pox is, though, yo. Think about that. Like, all right, if I bring my sons in here right now and line them up right now and cut my camera on and let you ask them,
And
do any of y'all know anything about chicken pox? Ain't none of them good. The
you know
answer is
why?
no.
Because they got the vaccine for it, and that's what I'm saying. That's a vaccine that work. You can't say that
All of
this
that. There's not a.
vaccine works
They haven't
because
made a
you still
vaccine
have
that didn't
breakthrough
work.
cases.
They haven't. No, that's not true.
No,
Because
hold on. So
that's
I'm
not
just gonna.
true.
s-
That
s- So I don't know. I'm asking you, how many breakthrough cases do we have for chickenpox?
I don't even know if they even care to track that. But hold on, let's look it up.
And the reason why I say that is because the
All
date. All right, go.
you gotta hold on. I'm gonna go back to this to make sense for it. See, this is where you're stuck at, right? You're
Mm-hmm.
trying to say because COVID is popular, you're trying to say that people aren't still getting infected by other things that they were vaccinated against. That would be not true. Breakthrough chickenpox cases. And we have some.
Okay. Then I may be wrong. Listen, I'm wrong then.
There's a CDC PDF document that says varicella breakthrough. Hold up. To test or not to test. And a lot of these, like, they don't even look for polio no more. This is why I said what
Mm-hmm.
I said. If
Mm-hmm.
they if people hold up, incidence rates. I don't like some of these sources. I got a good one. Incident rate breakthrough Zilla hurt. Yep, here we go. But this comes back to what I was saying earlier about how people are looking at things like they're trying to measure them against other vaccines that wasn't as effective as this vaccine, and then they're hearing this, the media talk about breakthrough infections. It's taking me a minute because of my hand, man.
Yeah, but I
Here we
I
go.
don't.
Look, here we go. This is varicella. This is chickenpox right here, right? So look, unvaccinated, vaccinated, and you're looking for breakthrough cases. 1996,
So the
all
breakthrough cases in the yellow.
the unvaccinated are yellow, the purple are vaccinated. So you're seeing that there's cases of
Okay.
breakthroughs with chickenpox.
But the craziest thing is that as the years go by, you have more breakthrough cases than unvaccinated.
Because less people are getting vaccinated, less and less and less. And the problem is some people don't even believe that chickenpox exists anymore. But also, you have so many people in the population that is vaccinated against these instances that all you're going to see when you go back to this chart is
Breakthrough.
in the vaccinated group, because you vaccinated literally every born child against chickenpox.
Mhm.
You know what I'm saying? And for
Mhm.
the small numbers that have not, and this is weird when people tell you that when they send out letters that people need to get vaccinated against chickenpox because there's an outbreak, you're like, what? Can't even be
Yeah, because
happening.
you were like, I thought that shit was dead already. Like,
Right. Nah, it's eradicated. It's
no, I just was layman's term. Like
Yeah,
I ain't think.
yeah. Exactly, exactly. But it's been eradicated. However, it's still affecting people because we have data to show that there are some unvaccinated children that have caught chickenpox and could be spreading in the building. So if if your child is not vaccinated against, as the letter says, if your child is not vaccinated against varicella, you need to go get them vaccinated.
Oh, no, I'm up. Hey,
So
yeah,
look at that.
oh, wow.
So and this is when we rely on epidemiology. This is why like we got to study virology, immunology, and epidemiology, because now we need to know how to look at the surveillance of how the of how the virus is acting in the public. And this goes back to that data. This is why they got their chest out talking about against hospitalizations and deaths. We 98%, we good body. We ain't at 80, we over 90%. But the other thing about it is that when we start looking at infectivity, and let's say we have 90 some percent of people vaccinated against SARS-CoV-2, right? Uh Against COVID-19. We hella vaccinated. The only data that we're going to have is similar to the data that you're looking on the screen when we get to the 2000s. Is going to be cases of vaccinated people. You see what I'm saying? Like
Mm-hmm.
we're gonna see breakthroughs because we have more people in the population vaccinated. So that data is going to project that. So if you got 330 million people and 200 million of those 330 million people are fully vaccinated, then at some point cases in the vaccinated group are going to rise because we have more people vaccinated. But that ain't the case with this particular virus, because we have a large portion that is still unvaccinated. And now we're at a point to where we're averaging 6 figures a day again of people getting infected. So the benefits, bro, is that yeah, you want to protect yourself against that because you're there, you're doing it. Like and you wanted to use the case of chickenpox, that's just there to let us know, like, hey, look, it's still people that are encountering this, and even though it's not there, and that's good. And then here we go, it's incidence rate of breakthrough, right? Because we're looking at varicella observed in healthy children after 1 or 2 doses of varicella vaccine results in a meta-analysis. So we have a 2017 article here that deals with the highlights. Average breakthrough varicella incidence rates vary in different study design and types of vaccine. Second dose of varicella vaccine may achieve higher efficacy than that achieved with only 1 dose. 3 to 4 years apart after the first vaccination may provide more vaccine effectiveness. See, they got all of these things to work through, but it's letting you know that, hey, American Journal of Infectious Control is talking about breakthrough chickenpox cases. So it happens in all the vaccines. It's not just uh, these vaccines. And that's what people got to understand. That, oh man, he fell out again. All right, there you go. Yeah, you had fell out.
Oh no, I had to switch phone. My other phone died.
Oh, okay.
Now, thanks for the information, bro. That gives me more clarity on my decision. Keep it 100 with you, cause I never thought that. Well, I ain't look up the data to see if we had breakthrough cases for chickenpox.
Nobody's thinking about chickenpox. Nobody's thinking about measles. Nobody's thinking about those things because everybody's primary focus is on COVID right now. And so they forget that there are breakthrough instances in these others. Like I've always said, these viruses, even what I wrote in the book, these viruses don't stop infecting people. They don't.
Yeah, I agree with you with that, cause smallpox is still here. Like I feel with you with that.
Facts. You think some people want that?
I don't know. Hell no. Shit, I don't want chickenpox. Fuck what you talking about. So,
Yeah, I don't want that either. I mean, I had it as a kid.
yeah,
And
I had it
still got vaccinated, but my mama got me vaccinated, but I had it as a kid, boy. Them things tore my legs up. I was itching.
Hell yeah, you got to get that pink lotion. I forgot.
Yeah, man, that stuff stink.
Yeah, I mean, I had it twice, and then I got vaccinated. That's why, like you said, I pull my children out right now, ask them about chickenpox. They want to know nothing about it. Great point. But one more thing I'm gonna ask you about is when they do viruses, how do they really use a virus in the first year? Isn't it like 5-6 years before they bring a virus out?
So, nah, what you mean? You talking about as far as in a vaccine?
And excuse me, I'm using the wrong term. Yeah, the vaccine. Before they bring the vaccine out, they usually study it for like 5-6 years in it before they bring it out to the public.
Well, we in the middle of a pandemic, so we didn't have 5 years. But yeah, some vaccines are made in less years now. Like they've gotten the science down to where it was 2 years, right? And mRNA technology has been researched for over 30 years. So this is something that they already been dealing with. They just never got as far as they got until the code was cracked to move forward with these vaccines. They've been studying RNA for quite some time.
But isn't it the first time they're using RNA to do a virus? Well, I'm asking.
Most viruses are RNA. You have DNA and RNA viruses. So this is not the first time that they're using mRNA. This isn't the first time that they're using mRNA because they have studies where they are, with Ebola as an example. They have an mRNA vaccine going on with that. There's other vaccines that are mRNA driven that will target other ones. Like right now, they are developing or doing trials like with HIV and cancer using mRNA technology. But the understanding of this technology allows for those things to occur.
I got you. Well, I got you. But that's my thing about it. I don't know. But I'm trying to wait as long as possible.
You better get it. You got to get this book, bro. I'm telling you.
I do like to get your book. I ain't gonna hold you.
You get the book. It would help you. You know what I'm saying? If you develop any other questions along the way, it would at least give you clarity, but also help you understand what the vaccine job is. And ultimately, that's what's being driven home. Like it clears up a lot of confusion. Like Robert said regarding this whole pandemic. Like it's an actual useful tool. It ain't something that I'm just trying to project on people to sell a book. Hell no, it's an actual solution. Like, you know what I'm saying?
I don't think when I said it's BS, I didn't mean it to be.
No. I'm with you. That's why I ain't had no problem with you. You know what I'm saying? I knew because I'm talking and you're in the chat, so it's not like I can't catch what you're trying to say. So it's best for you to come on and kind of, you know what I mean?
Yeah. That's why I said I wanted to tell you like my experience or lack thereof from the virus, because that's why I'm like, I ain't gonna say like I'm immune. Like I said, I want to be like Aaron Rodgers. I'm immunized. But I mean that's my thing. Like certain people could do certain things and certain people can't. Like and not to be jumping off the topic, but it's kind of unfair. Like, it's just kind of unfair that we could be like, all right, certain people could say they're immune and still play. Certain people say, I'm not going to take the vaccine and don't play. So it's like, it seemed like it's more of a political thing than anything else. That's what they bring it to.
So we go back to Beasley. Beasley says he don't want to get the vaccine and it's based on ignorance. And he's clear. And then he came out and said that he would take the vaccine if Pfizer gave his wife some money. And someone offered to buy stock that would actually pay his wife, and he didn't do it. So he was caught in his trap twice. However, the problem is that some people are doing it out of ignorance and not out of intelligence. And if they had something that they could actually, that wasn't from doctors, that was more lay, that they can actually to help them along with, like Kyrie, for instance, claiming that he doing all of this research. And that's the reason why and then next thing you know, he just taking a stance against New York. He ain't doing himself no good because he done missed all these games. Yet he is still being paid. And I wish that they would have said without pay, because if you hit him in his pockets without pay, he would have been vaccinated, but also he wouldn't have been spreading misinformation. And I think the part of that is the misinformation campaign dominates the facts. And we can't have that dominating the facts because it's not based on real evidence. So when we go back and we look at the solutions to the problem, the vaccine prevents hospitalizations and death and the spread of severe disease. The vaccine provides a protection to all of us that natural infection can't. What am I saying when I say that? Because the mRNA vaccine technology trains your immune system to recognize the spike. Natural infection doesn't do that. Therefore, it makes you more susceptible for reinfection and spreading the disease.
Okay. So, I mean, like I said, eventually I'm gonna have to get it. I'm trying to wait as long as possible because then they
Why
have
would
more.
you wait for something that's gonna give you some bro? Listen, we in the
Because
middle.
they would
Listen,
have more
Omicron
information.
ain't severe. Omicron ain't as severe as Delta, but it's more evasive. But let's say you did get infected. If you get infected and then you get vaccinated, you have the best protection because you have natural infection plus vaccine protection, which is what they call hybrid immunity, which would mean your body recognizes both instances of encountering the virus again. You'll be able to clear it quicker. You'll be more healthier. You know what I'm saying? It'll stop the spread of disease. But let's say you do get infected, you could develop erectile dysfunction. You could have a low sperm count. You can have COVID tongue, and you can have long COVID, which could last months. So you're saying you're trying to wait as long as possible, and then the longer you wait, the more time the virus has an opportunity to encounter you. Then you're susceptible to all 256 symptoms that this virus will deliver or come with. And then if you got ED, bro, I don't know about your sex life.
Hold on. 256 symptoms.
Yes.
I thought it was only like 4. Like,
No, see, that's the problem. That's the problem. COVID yields 256 symptoms in the body. But the most common, some people, the average person with like the average severe is like 51. But there are 256 symptoms known regarding this virus.
listen, that sounds crazy. Fucking crazy. I thought it was like the cough, the you may
Now,
not get
those are
the
common.
Okay.
The most common. They talk about the most common.
Okay. Yeah. Listen, you did the research. I ain't go.
That's in the book.
I keep telling. I got to get your book, bro. I got you. But I'm saying, like, man, listen, I'm scared of that. I just don't know. Everybody, like I said, everybody got it. I'm gonna have to get it anyway. It's just the fact that
you in New York, bro, like 70-some% of the population in New York vaccinated, yo.
Look, I'm about to say something gonna piss you off. Herd immunity.
That ain't even we don't understand. We don't understand herd immunity in this pandemic. You know what I'm saying? We don't understand that. And to be honest, that's why they pushing for 96% of the population to be vaccinated, because we can't achieve herd immunity at the level that we were at because we didn't have enough people vaccinated. And then Delta came off and said, the hell with y'all thinking y'all finna get herd immunity. I'm finna tear this up.
Yeah, Delta was stronger, but this Omicron is not as deadly as the Delta.
Nah, it's just more infectious.
Yeah. And well, isn't that a good thing? Not to say that anything good about a virus, but the fact that
one of the major symptoms in Omicron is erectile dysfunction.
oh wow, you just gonna throw that at me. God
Yeah.
damn. Yeah, it sounds like I'm gonna get it. I'm gonna get the shot.
Yeah, your old lady gonna want you to get it, or girlfriend, or friend, girl, or whatever.
I'm gonna get this. Like I said, I'm gonna get the shot because of my job status. I will have to get it, but I just feel like, but like once again, like I said, my 6-year-old. I'm about to have a conversation with my children, but the 6-year-old, I just feel like children that young, I don't know.
But what about so what about your child, right?
Mhm.
Your 6-year-old. Your 6-year-old encounters it. She's infected. She brings it home, and now mom encounters a breakthrough infection, which may lead to severe disease, and then the household has an issue. And then it now is your responsibility. Like those are the things that we're not really fully thinking about because we're shallow in that thought process. Like for instance, Chavis, come on the show. Hold on, I'm gonna give you a good example of this. Chavis, come on the show.
My bad. That was my daughter right there.
No. She good. You good, bro. See, Chavis' daughter is 6 years old. That's why I'm telling him to come on the show. His daughter's fully vaccinated. So if there's anyone that can speak to the experience of a 6-year-old daughter, it's Chavis.
I mean, like I said, my two oldest, yeah, they vaccinated, they fully vaccinated. But the craziest thing, they end up with it after they had a breakthrough after they got
Yeah, because
vaccinated.
you got to think about it, yo. They get vaccinated, and the first thing they think they don't want to wear a mask. Hold on, Chavis. I'm clicking too many times.
Nah,
They don't want to wear a mask, and then the sanitary part of it may be a little bit lessened, but they think they can get vaccinated and then go hang out, kick it, chill, do the teenage thing.
mhm.
Not knowing that this virus don't care nothing about the teenage thing. This virus still gonna do what it's gonna do, and you're gonna keep on encountering it until it breaks through. And pretty much that's what people don't understand either. Like you may be fully vaccinated and been fully vaccinated for a while, you not had no breakthrough infections because the virus just ain't. I mean, you've been invading it because of your protection, but that waning protection at some period of point, whether natural or vaccinated, could make you more susceptible the minute it's like playing Russian roulette. But go ahead, Chavis. Your daughter's 6. What's up? What made you get her vaccinated? Answer these questions.
This virus ain't no joke. Everything you just said is the fact that uh you want to have your household vaccinated to at least that's like a safe haven that you created, so ain't no virus, what I'm saying, gonna last too long. You might can get a breakthrough, but it ain't gonna be too serious. That's my main thing, cause I'm not gonna play them type of games with my kid. I'm more concerned about what the virus can do versus what the vaccine could do, because everything that people throw about what the vaccine could do to some kids is hella rare. If the shit the virus is doing to people, that shit, you know what I'm saying, that's pretty prevalent. And it's too much shit. Like he just told you, it's 200. It
I
ain't
feel
no
you, bro.
foe. It ain't no foe. It honestly, like with kids, they handle it better. Cause I got a cousin that's the same age as my daughter. Her mama didn't get her vaccinated, and she right now, you know what I'm saying. They ended up they went to a graduation and it spread through everybody, and it was a lot of breakthroughs. But shit, everybody pretty much straight. Nobody's in the hospital. We talking about like elderly women and you know what I'm saying, some women with issue, different type of conditions, whatever. Everybody's good. it could be way worse. Because when my cousin caught it before there was vaccine, he was tripping with the, you know what I'm saying, feeling like he having heart problems, he's anxiety issues, he lost his taste and, you know what I'm saying, smell.
Mhm.
That shit was crazy. You know what I'm saying? So it's
Yeah.
better safe than sorry. Mainly, that's why I did that. I got 4 kids. The only one I don't have vaccinated is because they can't get it right now. They ain't old enough. But as soon as probably February come around, they gonna get it too. Cause I got an 8-year-old and a 10-year-old as well. We all got. I got them all at the same time. Right to CVS. Whap
Yeah,
whap whap.
yeah,
Straight
like
like
I
that.
said, my two oldest got vaccinated because of school. Well, yeah, because of school. They got vaccinated. One is in college, one's in high school. Both got vaccinated. But my youngest at the time, mind you, we all know the 5 to 11 doses just came out. So at the time she wasn't able to get it. But
Right.
mother my children, she's talking about we having a discussion and she's talking about giving my daughter it. And I was like, let's talk
Man,
about it before we go
most
ahead.
of most that's gonna happen, bro, is she gonna be sleepy and she might have a sore arm. That's it. To be honest, that's the most, like, as far as what's called reactinogenicity. Those are just that's your immune system responding. That's basically what that is. That even the sore arm, all that is just telling you that she's doing what it's supposed to do. And mine, the second shot, they were like, shit, that I don't even feel nothing. And
Yeah,
mine was
that
excited.
was my kids, bro. Like I had a reaction, but these dudes they ain't had nothing, yo. They were like,
They was
they got
outside playing the next day.
yeah.
Right, right. I mean, I hope it's like that. Just,
Nah, it's more common like that than that.
yeah, that's that. I mean, like, listen, if I give my 6-year-old, I would have to get it my damn self because I'm not gonna put her through it and then I go through it
Right.
myself.
And that's really why they wanted it when I did it, because they seen that I've been on it. I've been trying to do, you know what I'm saying, the clinical trials and shit from Moderna way back from when nobody niggas was scared to do it. So they been watching me. They like, Dad, when we gonna be able to get the vaccine? They in middle school, you feel me?
Mm-hmm.
So they been one, not they in elementary school. I'm sorry, but they've been wanting to get it before they could even get it. They've been like, I've been trying to put them in the clinical trials just so they could, you know what I'm saying, experience, because it ain't like it's
Oh, so
it's
you did the clinical trials before it even came out?
me and my wife. But I got they put me. They said I had hypertension the first time, but my wife ended up doing the one for Janssen, but she ended up being getting the placebo. So,
Oh, okay,
but
okay.
but she got Pfizer. I got Moderna. My granny got Moderna. My auntie got Pfizer. My kids got Pfizer.
So
My
which
cousin
one is
got.
the best one to get? Since is that
If you ask us, we biased. We gonna tell you it's Moderna, but you need to just get you a shot. But Moderna is looking the best data wise. You
I'm
know what
not
I'm
getting that
saying?
Johnson for sure. I tell you that.
I mean, now you might. I ain't gonna. I mean, if you had nothing else, but you got too many options right now. We in America. You can
They
get
even
them.
got a pill right now. I know the
If you
pill.
getting Johnson and Johnson, then
You got
you
to
need
get
to have
two.
a two. So you need to get two shots.
No. What I said, I'm not getting Johnson and
Oh,
Johnson.
okay, okay.
What did that
Yeah, yeah, yeah.
60% efficacy or something like that?
No, actually, the second dose boosted the efficacy. That's what
Yeah,
they
it
finding out
increased like
now.
hella. Yeah, it increased
Like
hella good.
it's good protection if you got two shots. But we in America, like I say, we kind of spoiled over here in America. Everybody don't got mRNA vaccine. You know what I'm saying? Like
Okay.
my little brothers, they just came from Switzerland. They had to get the other vaccine, but then they had to get revaccinated to come over here. You know what I'm saying?
Wow.
They can't, you know, because they from Switzerland, so they had to get that bullshit. And I asked their mama, which one you got? Oh, I got Moderna now. I'm like, oh, okay, you Moderna gang, you M gang with us, so you good. You feel me?
All right. Very good, man. Like eventually I'm gonna have to get it because my job said we have to get it. So
Man, it's
Man, you
it's
should have
it's
been
better
got
for
it, man.
you, for real, man. You don't want to be out here playing games, man. Cause really, right now it's rampant. Like the Omicron is everywhere.
mhm, I'm hearing that. Yeah, I'm hearing that. It's everywhere, spreading fast.
I'm talking about in Texas, it's rampant. Like they just found my granny tested. She got it. They all got all people just don't understand with that though. Everybody neutralizing antibodies is gonna wane like Sean was saying. That's gonna happen. It's regardless. It don't matter which one you get. You're gonna have some type of your immunity is more complicated than just you're neutralizing antibodies. You have T cells, you have B cells, you know what I'm saying? Especially if you under, 50 and you keeping, you eat right, you know what I'm saying? Get your exercise in, you ain't too much at McDonald's, you know what I'm saying?
Mhm.
You got yourself a little advantage, you know what I'm saying? Just on that. But it's better to be safe than sorry though, man. That's the main thing though. You gotta get anything though, get that Moderna though.
Feel you. All right, next talk. Thanks for the info though, for real. Cause then and I Sean, yeah, I gotta get your book. But
You gotta get that. That's like a virology workbook for our people. That boy he did that. You know what I'm saying? I put a stamp on that.
no doubt, no doubt. All right. I'ma look into that. Nice talking to y'all, Sean. Nice talking to you
Nah, no
too.
problem, bro. No problem at
No
all,
problem.
man.
All right, peace.
Yeah, man, that's that on that, man. We ain't got no other questions, comments, concerns in the chat, yo. You know what I mean? Anybody want to come in and even if you want to come in and talk about the book, yo, I mean, hop on in, man, and get to it. We ain't doing nothing unless you like ignorance. You know what I'm saying? We can get into some ignorance. We can get into some ignorance, but I like
Try
to
to
keep.
avoid it.
I'm trying at all costs.
But man, it's a waste of time, waste of energy, man.
Yeah, especially when your competence is low on a subject matter.
Exactly.
Like, bro, what are you talking about, bro? You don't even know what the hell you talking about. You just talking. But nah, man, I'm glad Buddy came on, man. I remember, vaguely remember, I was trying to peep the voice, but yeah, I remember talking to him before. We had conversations before about the stuff. So I just hope the brother is kind enough to even get the book and
He
really,
sound like he's receptive, like he
yeah,
learned some
yeah.
things that he didn't know. Like these boys just be asking, that they think that it ain't no answers to these questions. They used to stumping people.
Mm-hmm.
That's what I think it is. I be doing like I had did the same thing in my house when they was talking about. Let me hold on, man. Let me educate y'all, man. Y'all got a amateur doctor up here, amateur virologist up in here, man. Let me help y'all out and assist y'all with what y'all seem to be missing the point on, because it be a lot of that misinformation. It flow.
Yep. So I don't know what other news we actually can get into right now, man, outside the fact that, they're talking about this potential super immunity, but more data is required on the outcome of that. You know what I'm saying? So um,
Wait,
we just need to wait on that part. And then once that occurred, then we just kind of handle business that way. What you got? What kind of news you done bumped into?
just right now with Texas is
Oh
getting
yeah,
crazy.
straight Texas.
You know what I'm saying? Like, and then I'm seeing it firsthand. You know what I'm saying? Like people that wasn't real skeptical now, the boys pulling up on me like, "Hey man, you talked to so and so? Yeah, man." They say, "Man, what you know about that?" Da, 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 da. People starting to pay attention now because that news scaring them though. With that, I just don't like the whole focus on the neutralizing antibody aspect part. Like, oh, your shit is dry. Well, niggas is not in hospital, man. I mean, they still everybody's doing pretty much well. Everybody's you might get the sniffles. I had to tell my granny, hey, nah, you don't need to call them to go to no ER or nothing like that. You just tested positive. You got viral particles in you. They don't necessarily just an infection. Infection is they keep on saying they catching COVID. No, you catching
Yeah,
a SARS-CoV-2 infection.
right.
Then they saying it's no, the virus is Omicron is just more fit. Look up viral fitness. Understand how that works. Understand virulence.
Why they think that? So why they think that? Why people think that? That they just having these that the vaccine ain't working because they still catching COVID. Why they saying that?
Because they keep on seeing on the news that that people is catching, and then they the way that it's being framed, they're saying these people catch or they tested positive for COVID. No, they tested positive for you know what I'm saying? Like it's they don't have disease, they have an infection. Like, there's basically that's it. They don't understand the difference
Say
between
that part again. They have what?
what
What do
they
the
have an
people have?
infection. They
They don't
have
have.
a
They have infection. They don't have disease.
yeah, they don't have disease. Yeah.
Hold up. There you
Yeah,
go.
yeah. I just bought the. Well, I just ordered a book.
Huh?
Just ordered.
Oh, I'm gonna sign it, and of course, I'm gonna sign it and send it to you.
Yeah, yeah.
So like I'll make sure like on Monday that
I mean, whenever you get the opportunity to.
nah tell him
Nah, we don't
Tavis.
play that.
Tell
We
him
don't play
Tavis.
that. Huh?
Tell him, bro.
We don't play that. We give you. We don't. We serious about that, man. You buy that. We sending that.
Can I
You
ask you? Can I ask you, Sean? What's the name? Let's talking about. Can we talk about that? The Big
Big
Bang.
Bang.
Yeah,
Yeah, if you want to talk about it, I mean, we just shooting the shit right now.
yeah. We're just shooting it. You know what I mean? Because I was like, I didn't understand how he didn't agree with you about the Big Bang when he agreed with you about the big. Like it was confusing me. I didn't understand. You,
uh,
Our position, man. He didn't want us to frame it as it's being a sign like they had a scientific theory or something. I don't know, but I was kind of confused as you though at certain points because I was like, I mean, there's similarities. We're not gonna ignore the similarities.
but the key word in all of this though is the Congo teachings.
Right.
It's not science. It's not the Congo science. It's the old ancient Congo teachings of how they absorb their natural world.
The world is why I said if they were like, no, not their worldview. It is their worldview.
It's
This
their
is how they observe it.
worldview. It's their
It's
worldview
how
on
they
how
see
they
things. It's their
explaining things to
cosmology.
be. And then he says mythology, but they didn't use a mythical sense. But however, they did when they talked about some type of deity,
You know what I'm saying?
shaping
Even with
dough.
that, that's just expressing certain concepts in a certain ways that they understand that we not gonna understand because that's a god.
And you
No,
have to
you're not.
think about it. But think about this. They want a 2021 explanation for something occurred in 1300 AD. Like they don't have the mathematical equations to come up with a lot of things, yet they were ahead of their time in some of their guesses, right? And some of
Right.
their guesses they were ahead of their time. But it was just disingenuous. Like the competency level right there is just Ong just has a bridge up because he's trying to be anti something. Like he's
You
so
anti-universe.
oh
That's
no
what
no
he's
no
anti-universe.
he's so anti-religion, right? He's so anti-religion that if something sounds like that to him, he gets defensive, and he doesn't he gets defensive to a point to where he can't hear the rest of what you're saying. So even in that little rewind, it showed his competency level because I clearly said in there that the Congo believe that the earth is a green state, is in a green state, which means that for the Congo, this is not the scientific explanation for the earth. They were sitting here trying to say, but the earth is blue or they were trying to do all of that. That made absolutely no sense for them to say that. None. Listen to how they explain the green state. The green state is a state of living where things can develop, live, and continue to survive. Is that not Earth? Are things not developing on the planet? Do we not have grass? Do we not have trees? Do we not have life like animals? Do we not have an animal kingdom that continues to develop here? For the Congo, that is considered a green state. A gray state or a gray planet would mean that there's no life. When they look over Saturn, when they look over to Pluto, right, Venus, like there's no life. As we know, there's no life. So to the Congo, it would be classed as a gray state.
But
And
he
then
was
you have a red planet, right?
Mars.
Right. Those are planets that are still in their infant stage. They haven't went through their processes of maturation like the Earth has. They're still in their infancy. So then he goes out and today in his rewind, and he says what I asked him yesterday that he wouldn't answer is that I said, was the Earth ever hot? Was it ever a lava state? I said that on the pseudo killers. He kept avoiding it. And then all of a sudden, he says today, I didn't want to get into all of that because you was hiding the fact that their example of what a red state, a red planet would look like would be indicative to what the Earth started out as. And then there was a cooling process, which that's what the Congo says. That says that it was a hot fire, and then there was a cooling process. So he was very immature in ignoring that.
Oh,
That
so he's
explanation.
trying to put that in a sense of religion. That's why he didn't want to agree with it. I'm trying to understand why he was fighting that fact.
He didn't want us to characterize it as science. Like he felt like we was trying to say it was like a science.
No
You know what
one
I'm saying?
says it.
Like,
Yeah, no one said that. I clearly was basically giving you how the Congo saw things. Ben gave us how the Igbo and the Yoruba saw things, and the Togo, and we can continue to go and the in Egypt. We can go all the way around the continent. They're trying to explain how things came to be. Out of darkness, there was no light. What are they saying when that happened, bro? Was there light on earth? Has it always been light and life on earth? Yes or no?
no.
Yeah, I'm stuck with it. Has it always been light in life?
Yeah.
Life came at one point. You know what I'm
Right,
saying?
because at one point,
It
well,
was
you're
just
talking about
matter, and chemicals,
matter,
and shit.
little amoebas and shit like that. Yeah. I mean,
It all
yeah,
depends on what you call in life. You know what I'm saying?
right.
Like that shit gets. I say
I think
I
that
didn't
was some
understand
problem with it though.
either. I understood what he was that part, but I was like at the same time, like they didn't like say nobody never said that that's what was what I'm saying being
Yeah,
articulated,
nobody was projecting science on anyone. Yeah.
and he kept kind of projecting that, and I was like, nah, bro,
But
like
he's not
nah, you project.
anti-science though. That's why they understand. Like it's not. He's not
But
anti-science. It's
but he
not
was trying to say
religion.
that he was trying to say for to help you out. He was trying to say that the Bible was also trying to explain the same thing. So then that would give them some type of leeway or ledgeway to actually deal with what they're trying to deal with. And then basically we were saying how sway because neither the Bible ain't even talking like that, yo.
Right. Because they got two creation stories in the Bible, so they okay.
It goes back into dismissing, like I said, their teachings. They're not they don't have the tools today. So for any person to sit here and saying, well, they couldn't have known that because they ain't had a telescope, so they ain't have this to measure that, and blah 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 blah. Duh. But if you know anything about science, the development of science is not only is it self-correcting, but it's always improving itself. And these are what a Big Bang ain't what people call the Big Bang. At one point, the Big Bang was known to people as a loud, not necessarily a loud explosion per se, but loud as in the activity of the scenario when two things clash together was loud. Not sound wave loud, but loud like its
Even with that,
impact
they was trying
was
to pay
massive.
the expansion part, like, because it like it was supposed to be like, what's expanding? What's like, even when something explodes or like that shit's like chemically, if we understand all that, something's happening there. You know what I'm saying? Like, come on, kid. I did that shit. I gotta feel like, come on, man. We been silly, and this is technicalities that's we tripping on, and
Yeah.
all y'all
He
was
was saying,
doing
I
was
got a
just.
problem with all of that. I got a problem with all of that. All of that's wrong. Where is it wrong at?
That's why I asked,
So
like,
there
what
was no
metric?
magmatic matters. There was no Big Bang. You wrong. You
Yeah,
got something
he
wrong
didn't
with that?
like the Big Bang.
Nah,
We
he
cut.
can't not like the Big Bang because he subscribes to it.
Yeah, but every time you said the Big Bang, he was like, he didn't want you. Like he was fighting that notion of the of a Big Bang, how they thought about it as a Big Bang. That's what I got from it. I
That
don't
was
know.
him being
Because it's
childish.
like, it's kind of like that part of it is something that some people don't fully understand. Like they articulate it a certain way. Like they start at the Big Bang and they don't really deal with the expanded that all that shit before that you got to factor in. That's all he was trying to say. I think, but at the same time, it's like, bro, all LaShawn and them was doing is just showing like, don't this shit sound familiar? Don't it sound similar? And if you really sit back and listen, like that shit's kind of weird. That they don't have no telescopes. They don't have none of this shit, but it sure sounds pretty similar to you, just in a different interpretation, if anything. You know what I'm saying? I think his issue is just how so we got to always look at how we viewing things, where are we viewing it from? You know what I'm
Yeah,
saying? What,
the
like,
lenses, how we look at it, right?
exactly, like whose lenses are we looking through? And like, yeah, we being scientific, but you gotta understand certain aspects of that get kind of tricky. You know what I'm saying? Like, who is, where is the agency on that, and like what's going on here? Like, why do they have to be like the end all be all as far as certain, like, and it's not like you trying to tell, you're just saying it sounds, pretty similar. I'm not gonna sit here and say it don't. You know what I'm saying? I would be lying. 'Cause I deal with science too, and I'm like, shit, that shit sounds
But
just
look at the explanation, right? Let's put that into perspective. Is this explanation, when you're explaining it to people who have no idea about the 21st century or the year 2021 and all the tools that they have in 2021, if this from 1400 years ago, does this not sound like, and I'm hypothetically speaking, right? Because the book was written in 1980, but does this not sound like, right, based on their teachings, some level of trying to understand the universe?
Right.
Rather, now, what you do now with these teachings from the Congo is you measure how much that they got right in their teachings and how much of it is wrong. And position is that they got it all wrong. And then when you ask, where did they get it wrong? And you start giving examples and you start re-explaining what their teachings say, then you turn around and he can't say nothing. So, did the earth not expand and have a firing process? And then what left behind that came a cooling process? Do you see what I'm saying?
Right, right, right.
Where is that wrong, Unc? No, that's not wrong, but that's not, they had no way of knowing that. See, you changing the argument. The argument is not how they came to the conclusion, because no one knows how they came to that. You know what I'm saying? We can't sit here and say how they came to that because we don't know, but it's in their teachings. But what we can say is that not right or wrong
right.
scientifically?
Do it matter? Because that shit. I mean, some of that shit, it is pretty. You know what I'm saying? pretty
Right.
similar.
And then when it says this, right, this is where it gets even good. It is the process of cosmic expanding fires. Is that not true? You just sit here and say what you say. This is why I said he got to be careful, because I clip him up and do a Jehudi on him and make a joke out of it. But the point that I'm trying to say is, now take the word green out of the equation. Forget the word green, because they just called it a color: green, gray, red. Take those out. And if the explanation says that the Earth is a breathing planet, well, they say this: breathing planets are living planets because they have completed their 4 great formation stages of the Congo cosmogram, known as the Dekinga dia Congo. The key word to these planets is green, the vitality giving nature. Planets like our own planet Earth can be thought of as the oldest planets to the solar system. The Earth, for example, can be seen for the Bantu people as the oldest planet for the solar system. Planets occupy the center of the systems in our expanding universe. The expanding creative fire energy that departed from the first event, or the Big Bang, was not an experimental explosion from a laboratory, say the Bantu Congo. It was a natural, imperative order to bring a transformation process into being throughout the universe and into all the planets until their full maturity, i.e., be able to breathe and carry life. Did the earth not come into full maturity to be able to breathe and carry life?
I mean, we here right now, so I'm breathing. Nice breeze outside. Trees
Right.
all over the place.
That is what I'm saying as far as how their teachings are. And then you go look at the science and you see what science says about it. And then you correct them, right? Based on where the disagreement is. So you would have to narrow down how science explains how the earth came to be. And how much of that did the Congo actually get right, whether they guessed it, whether they measured for it, or whatever? We don't know. It was said on the show that we don't know how they came to what they came to. This is their teachings. The key word in this is the teachings of the Congo. So based on their level of knowledge and understanding, right, they taught this. Now, what was right and what was wrong? He said it was all wrong. He said all of it. So the earth wasn't fiery. It wasn't breathable. It wasn't inhabitable at first.
Mm.
And it didn't go through a cooling process. That's what I mean by what I'm saying. Like, the competency level is low because he doesn't want to succumb to saying, all right, okay, I get that.
He said all of it was wrong.
He just said all of, look, don't make me pull up the video that
Nah,
they
don't do it. Don't do it. I don't.
they're probably still live right now. And he
I think
said
so.
this on the live stream that they're on right now. He said that all of it was wrong. When they played the part where I went through the explanation, he said all of that was wrong. And he never says what is right.
I can't fight him on that. I mean, I can't fight you on that. Obviously, that's wrong. But
Then he was saying that, you was basically trying to frame it like they didn't have a belief, but he just didn't understand. Like, bro,
I ain't saying
it's
nothing
just
about
a
no
way of
damn
life.
belief, bro.
Your way of life and your belief. You know what I'm saying? It's just how they conditioned to, sociological. Like, he confused me because he understood it from that, simple. Like, everybody has their own way of how the world came, but it's like, I don't understand. My thing is, I don't understand why there has to be an issue with,
right, because I felt like at one point he was agreeing with you, but like I was trying to say, it was like every time you were saying the Big Bang, he was like, nope, nope. Like, that part he didn't want to.
He didn't want to give them credit or presidents for having that type of an understanding.
Because he didn't want to.
But the book was written in 1980. The Big Bang is known to people in the 1980. So he can equate that, right? Without being scientific, he can basically equate that to what he's explaining. They didn't come out and say the scientific teachings of how the earth came to be. They didn't say that. He says, for the Bantu people, the Congo in particular, the universe as we see and know it is the result of a primitive event that occurred in and around it, well known as the Luku, Luwamba, and Zambi. God cooked dough, i.e. the magmatic matters, the Big Bang. So the issue that you would have in there is them equating it to Luku, Luwamba, and Zambi, which would be God cooked dough. That's where your issue is. Because you don't have an issue with an event that occurred in and around it. You don't have an issue with primitive event that occurred in it and around it. You don't have an issue with it is the result of an expanding fire process that leaves behind through a cooling process. If you do, you are a habitual liar. And we shouldn't trust nothing else you say. That's where I'm at with that. So he better hope I ain't in one of those clicking moves where I want to screenshot him trying to be sarcastic, and then I chop him up from the video that they did earlier yesterday and chop it up and get it, and then let him dagger himself, put Unc against himself, because he over there trying to get them who didn't agree with him earlier on. He's trying to fight them until they agree with him.
Yes, that's bad.
That's the truth. So what we gonna have is Unc versus Unc. As a matter of fact, I'm gonna wrap this show up.
Uh-oh.
And we finna get into Unc versus Unc.
Oh,
Who's
boy.
gonna be an Unc versus?
Yeah, it's Unc versus Unc. He
Unc
gonna
versus.
debate his damn self.
God.
Give me about 20 minutes. I'll be right back, y'all. I appreciate everybody for tuning in, man. Like the show, share the show, tell a friend, tell a friend. I'll be right back.
All right, peace.
Straight up.
Stop playing. That's the code.